information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. Take a pen and jot down this information. Right from the Heart assists families in finding the right living arrangements for their aging parents. Founded in 2012 by Sharon Agate, Senior Lifestyle Consultant, Sharon has counseled seniors and their families for over 20 years in clinical settings and in independent assisted living and memory care communities. Finding the right community can be overwhelming and time-consuming. Right from the Heart takes the stress and worry from you. Sharon will meet with mom or dad and evaluate their needs and lifestyle preferences and create a personalized plan at no cost to you. She will accompany you to visit selected communities and guide you every step of the way so you can be assured you're making a well-informed decision. Call Sharon at 561-374-4696. Sharon's promise to you is in your knowing that her advice will always come right from the heart. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is Caregiver Solutions Info with Marcia Teal. Marcia will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marcia has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marcia covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on caregiversolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marcia Teal, as she brings information to you that may just be the caregiving solution you need.
Hi, everyone, and welcome to Caregiver Solutions Info. I'm so glad that you could join us today. We are live from Boca Raton, Florida, and we have another wonderful program for you today. I just want to give a shout out to the Arden Courts of Richardson, which is a suburb of Dallas. I just returned from Arden Courts in Dallas, visiting them. And I just have to say, wonderful staff, wonderful people. And no matter where I go across the country, visiting places and going into memory communities, you know, you see the same thing everywhere you go. You see families that are in need of information. You see residents that, you know, need cared for, that are at home and maybe they need to be in a assisted living for memory care. There's lots and lots of issues out there, and this is why this show was actually developed, to help you, the family caregiver, get the answers that you need. We have experts that come on the show, and they are awesome because they are lending their expertise in their particular field. For instance, elder law attorneys, physicians, social workers, geriatric care managers, and many, many more. They are here to help you. If you're a caregiver and maybe you can't go to support group meetings because you can't leave your loved one at home, or you don't drive, or maybe you're just in the very beginning stages of learning about Alzheimer's and dementia, and you're not real comfortable yet going out and letting people know, you know, what you're going through. And that's perfectly understandable. It takes time. It's something new, and you will learn. So I hope that you can learn from this show That's why we have it. It is every Tuesday, and we're in South Florida, so it's 5 o'clock p.m. Out in Texas, they're watching it now at 4 o'clock p.m., and you can also listen in South Florida on the radio, AM and FM, 1470, AM and 95.3 FM. We're live streaming right now, and I'm so excited to go ahead and offer this book to you. I want to start out the show today. Usually we wait till halfway, but I want to start out by offering this book. This is the 36-hour day book. I want you to know about this, first off, because it's a wonderful resource for family caregivers. It was written by Dr. Peter Rabins and Nancy Mays. It's in its 5th edition, so it's very well respected as a resource for caregivers. Arden Courts would like to give you this book absolutely free just for asking. All you have to do is call their toll-free number, which is 888-478-2410, and let them know that you heard about it on the Caregiver Solutions Info show, and they will be happy to get your address and name and mail a copy right to you absolutely free. So we'll be giving that number out a little bit later in the show, but this is highly recommended, and I hope you take advantage of this. So I want to start out by posing a question to you, and let's see what you all think. First of all, I want to tell you that a geriatric psychiatrist is a detective sorting through a maze of information, including a person's background, life story, medical, neurological, and surgical history, and medications to determine what is causing the symptoms of concern. For example, is a person depressed because he or she is getting forgetful, or is he or she forgetful because the depression has been inadequately treated? Well, my guest today will address this question and lots more. So I'm very happy today to introduce you to Dr. Arthur Roscan, MD. He's a board-certified geriatric psychiatrist. Welcome, doctor.
Thanks for having me, Marcia.
I'm so excited that you're here. This is such an important topic. Talking about psychiatry, dealing with dementia, depression, so many things are involved when our caregivers are caring for someone with memory loss. So I want to get right into some questions with you.
Good.
Because you are a geriatric psychiatrist, sometimes I talk to caregivers, and some caregivers mix up the difference between a psychiatrist and a psychologist. Can you briefly explain the difference?
Oh, sure. And this is especially important, I think, as your patient population is getting older and getting more short-term or long-term neurological and medical conditions that might affect thinking and your emotions and your behavior. And so my background, after college, I went to medical school, and PhD or clinical psychologists go to graduate school after college, and I studied things like anatomy and physiology, pathology, and then in the last 2 years of medical school, you rotate through different medical and surgical specialties. And you work in the hospital, and you're kind of like the low man or low woman on a totem pole, where you follow the resident, the young doctor in charge, and you're under the supervision of attending physicians, doctors and surgeons who are actually in practice. And that's where a lot of the knowledge, a lot of the experience comes together, because you have this sort of hot environment in which you're treating actual patients and speaking with their families. And of course, anyone who's been in the hospital knows that it's a very anxious time and people aren't at their best. And so that's what you referred to as the detective work comes in. You have to look at all sorts of information, laboratory studies, diagnostic tests, CAT scans, MRI scans. You have to do the most important thing, which is to take a careful medical history and go back and ask again and get information from family members if they're available, and try and put the pieces together to basically figure out what's causing what. What are these symptoms? Very common in my background when I was an attending physician, a medical director at a not-for-profit community hospital about 30 miles west of Washington, D.C., I would be called in for a case in which a perfectly normal 73-year-old woman would have, say, hip replacement surgery, and there would be complications. The person might become confused in the middle of the night and think that the nurse entering her room was a burglar trying to break into her home. And so you'd try and figure out in short order, was it a laboratory abnormality? Was there an infection? Were these side effects of a painkiller after surgery that was causing a person to get confused or even paranoid? And so trying to put all of the pieces of information together. And I guess that's what's unique about approaching geriatrics from the medical standpoint, is you're aware of so many different types of processes that can affect a person's thinking, their level of awareness, their behavior.
Yes, thank you for that, because those things that you described is not normal for a particular person at that age going in for hip replacement. So when things are not normal, then, like you said, you have to figure it all out, and it can be very much like a detective from the medical point of view. So why would somebody go to more of a psychiatry versus psychology, even if they're dealing with maybe some memory loss? Would they use both at some point?
Very commonly, you would use both, and there's a lot of overlap. We're close colleagues, the clinical psychologists that I've worked with, and geriatric psychiatrists. There aren't many geriatric psychiatrists, and I'd say it's kind of like a mixture of primary care medicine and neurology and psychology, and you're trying to use expertise from all of the above to put the pieces together.
So you encompass much more and a broader spectrum, it sounds like, in addressing the whole person.
That's right. I mean, of course, I'm interested in the background and the psychology, if you will, about the people that I'm asked to evaluate, but I also have that deep background into how an upper respiratory infection or a certain type of medication can cause different problems. And so that sort of deep roots, I guess, in medicine and basic sciences is really invaluable to try and, get to the bottom of it.
Absolutely. Well, I love this. It's going to be a great conversation with Dr. Roscan, geriatric psychiatrist. We're going to take a quick break, and we'll be right back.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors.
Arden Courts is not just a place to live. It's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides.
Hi, I'm Michael
Often occurs with Alzheimer's or related dementias, even among their caregivers. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to Arden Courts. Memory care is all we do. We know, we understand, we can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines.
On caregiversolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
We're back, and my guest today is Dr. Arthur Roscan. He is a geriatric psychiatrist. And not only is he a geriatric psychiatrist, he's an extremely experienced geriatric psychiatrist who became double board certified. And I want to read this just so I don't get it wrong. A double board certified in both general adult psychiatry and geriatric psychiatry by the American Board of Psychiatry and Neurology. So I'm so excited to have you here, doctor, because we talk about Alzheimer's disease and other dementias, and I know you're in private practice. So being double board certified, you have neurology, psychiatry. How is your practice affected by Alzheimer's disease?
Well, that's one of the key areas that that people seek out my advice about. It's like, as your elegant introduction stated, these are not uncommon problems, and especially with the aging of the population, in any community that you're in, you're going to find people with cognitive problems, and by that I mean problems thinking and remembering and doing well the things that they've always done, and that these can take a toll on not only that person, but also their spouse or their significant other, if they have one, but also on different generations of a family. And so this is actually a large part of my practice, just because there are so few practical or approachable doctors who are interested in helping people with a diagnosis of dementia and of Alzheimer's disease. And by the way, Alzheimer's disease is probably the best known type of dementia. And dementia is just any condition that is affecting a person's brain and changing their ability to remember and to figure things out like they used to. And it's basically a question of what is harming the brain cells. Dementia is thought to be a progressive condition. It worsens over time. But while saying that, I should also point out that there are new areas of research that have the potential, and hopefully not too long from now, have the potential to kind of stop the process in its tracks. And so to make it so that early diagnosis and treatment with the latest of what's available to treat Alzheimer's disease is really crucial.
Yes, we actually stress caregivers to not wait. If they see something not normal for that person, like you mentioned, confusion, memory loss, not being able to do certain things they've always done, like balance the checkbook and maybe get lost while driving the car in their own town, things like this, to not wait, to go ahead and get the answers that they need to see what is going on. So they will usually start with their primary care physician, but that only can get them so far. And, the primary care physician can order tests and help to diagnose maybe what's going on with the MRIs and the psychological tests and make referrals to, I would assume, people like you who could go a little bit further to figure it out, to get a true diagnostic picture of what's happening with this person. Because a primary care might be the first step, but you go further than that to really get a true picture, because you want a real honest to goodness diagnostic effort to figure this out, because a lot of people can be misdiagnosed, right?
That's right. And what you're saying about the initial step of seeing a primary care physician is really important, because just the fact that the person themselves has noticed some changes and is talking to their doctor about it, and family members, noticing changes, it's important for a primary care doctor or a neurologist to check to see if there are any treatable causes of memory loss. For example, is a person, do they have thyroid hormone dysfunction? You can do a series of blood tests and check out thyroid function. A lot of times, if a person's thyroid is underactive, actually using thyroid hormone replacement can improve their memory and their functioning and their sense of vitality. There are other basic diagnostic tests that most primary care doctors will do. They might check serum or blood, B12 or folate levels, to check these vitamin levels to see if there's a shortage in the bloodstream, just because this is very treatable. You can take a pill to treat low vitamin levels, and that can actually prevent future memory loss. So there are a couple of things that are kind of basic to check, and usually somebody is referred to a geriatric psychiatrist like myself when there are reactions, like let's say a person is very depressed or upset or anxious, and that's well within my area of expertise to try to figure out what's going on and to treat what's treatable.
Mm-hmm. They've always said that the difference sometimes between a psychologist and a psychiatrist is that the psychiatrist can write the prescriptions for the good drugs, right? The medicine, the things that maybe somebody needs to help them because of their behaviors and because of what's going on because of the dementia. Being psychology would be more like talking about the issue. Maybe the caregiver themselves would like to go to a psychologist to talk about the stresses of being a caregiver, right? And talk about it. But yet their spouse who has the Alzheimer's might need services of a geriatric psychiatrist as yourself to pinpoint those conditions where you could help them because of major changes because of the dementia, like you mentioned, being maybe angry to the point where someone's combative. That seems to be a big one that people are really afraid of. When I talk to caregivers, they're so afraid that my husband's going to get so angry at me, he's going to hurt me, he's going to punch me. How often does that come up in your practice where caregivers are afraid of that?
And that's a very common reason why I'm asked to consult and to use my expertise to do something about this, abnormal behavior, aggressive behavior in somebody who a few years earlier wouldn't have dreamed of reacting that way. I mean, what you see with the brain disease of dementia is that it kind of takes away a lot of the filtering activity that you and I do in everyday life. And so there's less of a sort of a 5-second delay between being frustrated at something and reacting. People generally don't like to be told what to do. And when a caregiver, a family member, says, you know, you need to do this now, well, you know, the dementia victim will get frustrated. And unlike before, it's possible that they'll strike out verbally or sometimes even physically. And this is a common problem. I have this odd kind of subspecialty of least offensive medications that can be used to try and reduce this episodic aggressive behavior in somebody with dementia without overly sedating them, without snowing them, because that's a poor solution, in my opinion.
Yes, and again, something else that caregivers are afraid of is having too much medication for their loved ones so that they're completely knocked out, or as you termed it, snowed under.
Yeah.
And that's also a concern for caregivers. So from what my experience has been over the last 18 years of helping caregivers and talking to doctors, is that there's a very fine line between, you know, the kinds of medicines, the frequency of administering those medications to a person to keep them stable and not, you know, give them too much or too often so that they can't function.
That's right, and I see that very commonly. I mean, let's face it, usually by the time somebody has seen me, they might have seen 2 other doctors, they might have seen a primary care doctor or a neurologist, you know, their surgeon, and they're on a list of medications. And one of the things I like to do is to sort through these things. And I've developed this theory of therapeutic elegance. And what that means to me is if you can get one medication to do 2 or 3 different things, that's better than 2 or 3 different medications. For example, when I'm referred a patient, frequently I see that they're on an anti-anxiety medication or 2. They're on a sleeping pill. They might be on an antidepressant. And from my experience, I ask, well, why not use an antidepressant medication, which not only helps their mood, but also helps them sleep better at night and makes them less anxious? And wouldn't it be a good thing if we can substitute one medication and take away 3 other medications?
That would probably be a great idea for lots of reasons. Number one, you're going to reduce the side effects that are possible because every medication has side effects. You're going to reduce, I guess, the 2 medications maybe, or 3 or 4, however many they're taking, to be contraindicative of each other and causing problems within that. And least but not last, the fact that people with dementia don't typically like to take pills.
That's right.
And it's hard to get those pills down them. I mean, if you can, you know, get 1 or 2 that are absolutely necessary to take care of business, why give them a whole handful that they're going to get tired of swallowing, or they're going to spit out, or they're going to, you know, use their control, quote unquote, to not
That's
take
right.
it? Because, I mean, sometimes that's the only way they do have control, is I am not taking that medicine. I don't want it, I don't need it, and I'm not going to have it. And then that's a whole nother, you know, ball game.
And even though I'm a physician, I don't like medicine. I mean, if you can get by with none, that's best of all. If you have to take something, some time should be spent in thinking it out and, you know, trying to reduce the number and the side effects of medicine.
Yes, I totally agree. I've actually seen some residents who have dementia but are on 0 medicine, and they are just doing fine. They're
That's
enjoying
right.
life, they have quality of life, and they're not pumped up with a bunch of pills that they don't need. And, their health is good, their mental status is good, except for their memory loss, and they're fine, But a lot of other people that I have encountered, long list of medicine for all different kinds of things. So we're going to talk about this a little bit more because this is such an interesting topic and very, very important because caregivers are always talking about the medications and which ones and should I take the Aricept, should I take the Exelon? It's very confusing sometimes, because one doctor will say one thing, the primary will say one, the neurologist will say another, you as a psychiatrist may say another. So I want to get your take on that, but we'll talk about that as soon as we come back. So stay with us. We'll be right back with more from Dr. Roscan.
Take a pen and jot down this information
Feelings of
right from the
depression,
heart.
isolation, and frustration are common among persons living with Alzheimer's or related dementias. It's common among those who care for them, too. It takes a lot of patience and courage. It also takes knowing when you can no longer do it alone. At Arden Courts, memory care is all we do. Talk to us. We know. We understand. We can help. Don't let guilt keep you from making the right decision. Visit Arden. Somewhere at the corner of bewildered and confused is a lost mother, a father, a sibling, a grandparent. Wandering is a common symptom of Alzheimer's or related dementias and can often make those who care for a loved one feel just as lost. If you're looking for a place that's safe and secure, look to Arden Courts. Memory care is all we do. We know, we understand, we can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines. Being unable to recognize the obvious often occurs with Alzheimer's or related dementias, even among their caregivers. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to Arden Courts. Memory care is all we do. We know, we understand, we can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines. Feelings of depression, isolation, and frustration are common among persons living with Alzheimer's or related dementias. It's common among those who care for them, too. It takes a lot of patience and courage. It also takes knowing when you can no longer do it alone. At Arden Courts, memory care is all we do. Talk to us. We know. We understand. We can help. Don't let guilt keep you from making the right decision. Visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines.
Call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
I'd like to take this opportunity to thank our national sponsor, Arden Courts Memory Care Communities. Arden Courts is an assisted living for memory care because memory care is all they do, and they do it very, very well. We have 10 Arden Courts right here in Florida, 3 out in Texas, where I just returned from Richardson, where we have one in San Antonio and also in Austin, and the others are sprinkled across the United States. One of the things that Arden Courts likes to do is to take care not only of the person with the memory loss, but of their family caregiver too. We're a big family, extended family, and there's just so much that a caregiver can do by themselves. So we want to help you. One way is to provide this free resource. It's called the 36-Hour Day. I mentioned it at the top of the show, but I want to give you an opportunity again to write down the number to get your free copy of this book. I highly recommend it, and you want to call us at 888-478-2410. Again, 888-478-2410. Tell them you heard about it on the Caregiver Solutions Info Show, and they'll be happy to get your information and send a book to you. So do it today, and you'll be glad that you did.
It's a useful book.
Oh,
I agree.
Thank you, Dr. Roskin.
Yeah.
There you go. You got a great endorsement from our guest, geriatric psychiatrist, Dr. Arthur Roskin. We're back, and before the break, Doctor, we were talking about medications and how medications are administered to someone that has dementia, especially when they have a lot of issues going on. A person with dementia, if it's Alzheimer's disease, maybe the primary care has prescribed Aricept or Exelon or Namenda. And then maybe they get something else prescribed by the neurologist. And then all of a sudden they're taking a lot of different medications and things don't seem to be improving. They're getting worse in their behavior. They're lashing out. They could be super angry, super depressed. A lot of reasons why somebody would want to come to see a psychiatrist to figure out what we can do about this. What's your take on medications?
I think they're useful up to a point, and let me explain. I was in practice when Aricept came out, the first of the FDA, Food and Drug Administration approved medicines for Alzheimer's disease in the mid-1990s, and a short time later, Exelon came out and Razodine came out. And then around 2003, another medication that worked completely differently called Namenda came out. And here's the short version for our listeners. Basically, it's like a Chinese menu. In column A, you have 3 medications that work very similarly to each other. Their mechanism of action is very similar. Aricept, Exelon, including Exelon patch, and Razodine. They're good medications in trying to help deal with the memory loss and the difficulty doing things that a person and their family members notice in the early stages of dementia. In 2003, a completely different medicine came out called Namenda, and I was probably the first doctor in Northern Virginia to get it. I remember Namenda was approved in the fall of 2003, faster than the company that manufactured it anticipated it. And they hadn't even trained their sales staff that visits doctors' offices yet. And so I had read about it. I had patients who were interested in it because they had read newspaper articles in the Washington Post and the Wall Street Journal, etc. And so there was some interest even before it came out. And so I filled out a postcard, believe it or not, and I got samples in the mail. And so I began prescribing it in the fall of 2003.
Was that because it was maybe deemed the miracle drug? This was going to help people with Alzheimer's. It was going to make a huge difference in their their symptoms.
A lot of anticipation around it, and I think it was because this is something that worked differently than the first 3, and because frankly there's been too little progress in coming out with practical medications for Alzheimer's dementia. And so anything, there's going to be a lot of interest. And so what the state of the art became is one from column A, from that Chinese menu, Aricept or Exelon or Razodine, and column B, which was just Namenda. And since late 2003, I've been going to the annual meetings and following the journals and other sources of news from conferences, that there has not been a significant FDA-approved medication since 2003. And that's an awfully long time.
Yes.
The basic strategy that I would recommend to people is, as early as you notice problems, even if you might be among the worried well, speak to your doctor about getting some testing. Our friends, the neuropsychologists, can do some neuropsychological testing to get a baseline level of your memory function and your ability to do things. And, a couple of hours worth of tests are very useful to get an idea of how a person is functioning, and then go on one of the medications or, in many cases, an Aricept-like medication and Namenda to try and buy some time. And what we're all hoping for is that if you buy some time with this progressive disease, that, for example, medications that are in phase 3 clinical testing, being tested on humans in university settings, that might be able to stop amyloid that's in amyloid plaques and be something different about treating dementia in a way that can hopefully halt progression. And this is where a lot of the focus is. So as a practical person, I advise people to use what's available to slow it down, because, in 2019, you may have an FDA-approved medication that actually stops the disease process.
Wouldn't that be wonderful?
And so, so that's kind of where we are.
Yeah, I know your mantra is less is more.
Right.
You mentioned that you, as a psychiatrist, you really yourself try not to prescribe too many medications if less can do the job, so to speak.
That's right.
And there's reasons for that, as we mentioned before. So unfortunately, there's not a whole lot out there available, which is kind of sad. But then there are medications that you can prescribe for people that have other issues going on with their dementia, such as aggression. A lot of people can turn on a dime and not be the person they were for their life. And I had a caregiver once who said, I'm glad my mom had Alzheimer's. And I said, well, why is that? And she said, well, her whole life she was a nasty, mean old lady, and she beat us up, and she was a terror. And once she got Alzheimer's, she became the sweetest little old lady you'd ever want to know. So, for her, it worked well,
Right.
and it was a good thing, for that family. But other families are experiencing complete opposite, where you have
That's right.
a gentleman who was mild-mannered, and now he's the terror of the family. So these are things that you can help with, right?
That's right. I mean, I was thinking, ironically, even though I'm a psychiatrist, I prescribe less antipsychotic medications to treat behavioral problems of dementia than other doctors do. And if a person is having what they call behavioral and psychological symptoms of advancing dementia, if they're, for example, getting paranoid and they honestly believe that somebody is stealing their things and is trying to, do something, nasty, when in fact that's not the case. For a person who's very, very paranoid, I'm not opposed to using a very low dose of an anti-paranoid, antipsychotic medication. But in most of the cases I see, you see people with none of those symptoms of extreme paranoia who are on the medication just to, quote, calm them down. And I find that there are others with less, alarming side effects that can be used that are much more benign and improve the person's quality of life.
And is that what your bio says, how you're skilled in the art of psychopharmacology?
I've always liked it. I think I'm a people person, and I like biography. I like learning about people's background, but it's helpful to know the medications backwards and forwards. And I have to admit, a lot of what we do in dementia care is sort of off-label. A medication may not have been approved by the FDA for a particular use, but if it's useful, if it's well tolerated, if in the last 30 years that I prescribed it, it tends to be a useful medication, I'll prescribe it anyway. That's part of the doctor's discretion.
Yeah, because that's what the black box list.
That's right.
But if it works and it's, helps that person, then, I agree. It's a good thing, as long as they're tolerating any side effects there might be. What about, doctor, the person who needs to see you? They'll say that the caregiver is really stressed out, can't handle the behaviors at home, and the primary care suggested you need to take them to a geriatric psychiatrist for some help.
It's pretty scary.
It's scary,
Yeah.
but let's say that this person who has the dementia is fairly high functioning and won't go to a psychiatrist because there's a stigma with it. I'm not crazy. I don't need to see a shrink.
That's right.
That's very common, again, and caregivers like, what am I going to do? He won't go. So do you have any helpful tips for caregivers of how they can, combat that?
These are problems that people have that are not, I don't think of them as psychiatric problems. These are just common problems that go along with common medical conditions, neurological conditions, Parkinson's disease. People aren't ashamed to see their neurologist for treatment of their Parkinson's disease. But what if, as is often the case, there are some neuropsychiatric symptoms, and my expertise may be useful? I mean, I'm a practical person, and I would urge them to make an appointment with a geriatric psychiatrist. I try and reduce the stigma as much as possible. Sometimes, I don't even tell people that I'm a psychiatrist. My field is geriatrics.
There you go.
Which it is. And I'm a memory expert, which I am. And so it's no service to somebody to rub their nose in it if the first 75 years of their life they're trained that you have to be nuts to see a doctor like me. I know from years in practice that that's simply not the case. I've treated enough senior diplomats, people in the espionage world, general officers, doctors, attorneys, judges, cabinet members. I'm not going to get specific. Years ago, I've been in practice long enough.
Please don't name names. We might be in trouble.
That's not giving anything away, nor would I ever breach a person's privacy. But I'm saying I've seen leaders of the community. That's the point that I'm trying to make. And if seeing a specialist and tapping into their expertise can make a difference, as a practical person, why would you not?
Exactly. Well, thank you. That was a great explanation. I think that it's important for people to reduce that stigma. Just like years ago, the stigma of saying you had Alzheimer's was reduced when President Reagan made, public his condition. So we need to work on that a little bit more, and I thank you for that. We're going to take our last quick break, and we'll be back with more from Dr. Arthur Roscan, geriatric psychiatrist. We'll be right back.
Are you a senior? Do you need help in your home? Then
The inability to recognize the obvious often occurs with Alzheimer's, particularly among the family members who care for them. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to us. We know. We understand. We can help. Arden Courts. Wandering is a common problem for people with Alzheimer's or related dementias. It's also a problem for family members who care for them. Keeping them safe and secure means never letting your guard down. And even though deep down you know it's time, it hurts to have to ask for help. But it could hurt them even more if you didn't. We know. We understand. we can help. Arden Courts. Being unable to recognize the obvious often occurs with Alzheimer's or related dementias, even among their caregivers. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to Arden Courts. Memory care is all we do. We know, we understand, we can help. To learn more, visit arden-courts.com. Arden Courts follows equal housing opportunity guidelines.
Now, back to Caregiver Solutions.
I'm here. My guest today is Dr. Roskan. He's a geriatric psychiatrist here in South Florida. But Dr. Roskan, you didn't always practice here in South Florida, and I want to let everybody know about your background. But you and a colleague actually developed the first and only specialty geriatric psychiatry inpatient diagnostic and treatment unit in the Washington, D.C. metropolitan area many years ago. How did that come about, and why was that important to have?
Well, in the Washington area, I went to medical school at GW, and I did my psychiatry residency training at Georgetown University Hospital, and I was selected to be chief resident. And I went out into practice in Northern Virginia in the Washington, D.C. suburbs, and I thought I would do community hospital psychiatry for a few years. And I don't know what's wrong with me. I stayed for 21 years. I was the longest serving psychiatrist in the history of the hospital. And as medical director, I had the good fortune to help recruit a great colleague. His name was Paige Moss Fletcher, MD. And unfortunately, Paige died suddenly about 3 years ago from a brain bleed, and a great loss to the community. But in 1996, when I recruited him to come work with me at the community hospital, he and I were the only two board-certified geriatric psychiatrists in that part of Virginia. And so really, without getting permission from the hospital administration, we transformed our 20-bed inpatient psychiatric service into a geriatric specialty service. We helped train and select nurses interested in working with the mysteries of what's going on with older adults. And so none of the other hospitals, there were no other similar units in the Washington metropolitan area. None of my former colleagues at George Washington University Hospital or at Georgetown University Hospital had specialty geriatric units, and we became best friends with the rest of the medical staff because a surgeon having difficulty with a post-surgical patient of theirs who was becoming confused and delirious would be only so happy to transfer them to our service so we could figure out what was going on with them and try and fix it. And so word spread. I mean, we got patients from Maryland, Virginia, Washington, D.C., Delaware, West Virginia, and with no advertising, just so few people were doing these sort of services. And so it was an experience multiplier. For most of the time, I was working every other night on call, every other weekend on call, nights, holidays, and treating a lot of people. And so we gained a lot of useful experience, and that's kind of what made me. And this past winter, my wife and I were empty nesters. We moved from Northern Virginia, the Washington, D.C. area, to Palm Beach County. I have an older brother here who's a retina specialist, Lauren Roskan, MD, PhD, founder of the Retina Institute of Florida, and he encouraged me to come down. And so we've been in the area, and I've been building my practice. I spent the last 6 months of 2017 saying goodbye to patients and trying to find other doctors to take care of them.
Well, we're certainly glad to have you here with us in South Florida. There's definitely a need for more people that provide the services that you do, because as one doctor said, South Florida is like the tsunami of Alzheimer's disease. It is just running rampant here because of the elderly population and obviously people getting dementia, and they're very much concentrated here. So welcome to our community.
Thank you.
Thank you for sharing everything that you've been telling us today, because it's all very, very valuable information. If someone wanted to contact you directly, maybe set up a consultation or come visit you, could they do that, and how?
Yeah, absolutely. The easiest way is my office phone number, 561-529-1515. 561-529-1515. I also have a website, www.arthurrosecanmd.com, and that's probably the best way to contact me, and I'd be glad to help if I can.
Great. And what city is your office located in?
In Boca, in West Palm Beach on Flagler Drive, in Palm Beach Gardens, and in Stewart.
Wonderful. So lots of choices for everyone out there that you can accommodate them in many different areas.
I've also done some home visits and some facility visits.
That's wonderful. Again, so glad that you're here. Thank you for coming, and thank you all for tuning in, and I hope that you enjoyed listening to Dr. Roscan, geriatric psychiatrist, wonderful person, wonderful information. We will be back next week, same place, same time. Don't forget, in the meantime, give someone a hug, because they need it and so do you. And we'll catch you next time, and call and get that book, 36-Hour Day, 888-478-2410. Get that free copy and read it and give it to someone else who could benefit it as well. So thank you again, and we'll see you next time.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teal. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions.